Tetrahydrozoline is a type of drug called a decongestant that helps reduce redness in the eyes caused by minor irritations like smog, swimming, dust, or smoke. It belongs to a group of drugs known as sympathomimetic amines, and it works by temporarily narrowing the blood vessels in the eye. Some tetrahydrozoline eye drops also contain lubricants, which can help protect the eyes from further irritation and dryness. These eye drops can be used to provide relief from these symptoms, and the recommended dosage for adults is 1 to 2 drops in the affected eyes up to 4 times a day. It is best to use them as needed when experiencing irritation or redness in the eyes, but do not use them for more than 72 hours in a row without consulting a doctor. When using eye drops for irritation relief, it's important to follow the instructions carefully. Always wash your hands before applying the drops and be sure not to touch the dropper tip or let it come into contact with your eye or any other surface. If you wear contact lenses, be sure to remove them before using the eye drops and wait at least 10 minutes after applying the medication before reinserting your contacts. Before using the eye drops, check visually to ensure the liquid is clear and has not changed color. If it has, do not use the drops and discard the medication away from children and pets. You can use this medication up to 4 times a day in the affected eye as needed or as directed by your doctor. When applying the drops, tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Then, hold the dropper directly over the eye and place 1 drop into the pouch. Close your eyes for 1 to 2 minutes and apply gentle pressure near the nose to prevent the medication from draining away. After using the eye drops, do not rinse the dropper and be sure to replace the cap tightly. If you are using other eye medications, wait at least 5 minutes before applying them, and always use the eye drops before any eye ointments. It's important to avoid overusing this type of medication, as it may lead to increased eye redness when the drug wears off. If you experience this, be sure to contact your doctor. Also, do not use the medication for longer than 3 to 4 days at a time. If your condition does not improve or gets worse after 72 hours, or if you think you may have a serious medical problem, stop using the medication and seek medical help right away. If you experience stinging, redness, widened pupils, or blurred vision after using this eye drop, consult your doctor. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Serious side effects are rare, but if you experience eye pain, worsening redness, itching, swelling, vision problems, shakiness, fast or irregular heartbeat, headache, sweating, weakness, or nervousness, notify your doctor immediately. Seek medical help if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor if you experience any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this eye drop medication, make sure to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may have inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist about any concerns. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have glaucoma, heart problems, high blood pressure, diabetes, eye infection or injury, or overactive thyroid. After applying this medication, your vision may become temporarily blurred. It's important to avoid activities that require clear vision, such as driving or using machinery, until your vision has returned to normal. If you are pregnant, use this medication only if it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the drug passes into breast milk. It's important to be aware of potential drug interactions and how they can affect the way your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include feeling very drowsy, heavy sweating, lower body temperature, and slow or shallow breathing. Be sure to keep this medication out of reach of children and pets. If you're experiencing symptoms of eye irritation due to allergies, it's important to avoid potential allergens that could be triggering your symptoms. Common allergens include pollen, grass, weeds, dust mites, and pet dander. If your doctor has instructed you to use this medication regularly and you happen to miss a dose, make sure to use it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed dose and continue with your regular schedule. Remember not to double the dose to make up for the missed one. It's important to follow your doctor's instructions closely for the most effective results. Remember to store this medication at room temperature, away from light, and make sure to keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain, unless specifically instructed to do so. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.